Have you ever felt your phone vibrate in your pocket and checked it expecting a notification, only to realize there was nothing there? Now imagine experiencing that false signal repeatedly throughout the day. Pretty annoying, right? Well, this is what people with chronic pain experience, except it's not their phone's vibration, it's their nerves signaling pain. Almost 25% of all adults in the US suffer from minor or severe chronic pain, between 1.4 to 1.5 billion people worldwide being affected by it. A large portion of these cases lack a clear physical cause, with studies suggesting up to 40 to 80% of cases are misdiagnosed. Yet, even with this many people being affected by it, current methods of dealing with chronic pain are not sufficient. Over the counter pain relieving drugs only provide a temporary relief, and other drugs, like opioids, pose a risk for patients to get addicted when using without supervision. In fact, 1 in 8 people who use opioids to relieve pain end up getting addicted to them. Injections and procedures also only provide a temporary relief, such as steroids or radiofrequency ablation. The only long term solution to this problem is implantable devices, which cost a lot of money, which most people can't afford. This gap leaves billions of people at risk worldwide, showing the need for a more affordable and long term solution. That's where NeruoTune comes in. Hi, my name is Nishka Tikanda, the creator of NeruoTune. When someone experiences chronic pain, their nervous system becomes hypersensitive, like a smoke alarm that keeps ringing long after the fire is out. NeruoTune is a smart, wearable patch designed to detect and retrain overactive nerve signals that cause chronic pain without drugs, needles, or surgery. NeruoTune can be placed on areas corresponding to specific chronic pain conditions such as lower back, shoulder and neck, the knee or hip, wrist or elbow, or even the feet and calves. Placement is guided by simple instructions. Users can apply the patch over the area where the pain is most intense or where the nerve pathways converge. NeruoTune operates through a four-stage process built into a lightweight medical-grade patch. The first step is real-time detection. Within the patch are tiny sensors that monitor nerve electrical activity, muscle tension signals, skin conductance, and local temperature. These sensors work continuously to identify when the nervous system is transmitting pain signals that are out of proportion to actual tissue damage. Step 2 is the AI analysis. Inside the patch is a mini processor running an AI algorithm trained to recognize patterns of chronic pain signaling, distinguish flare ups from normal nerve activity, and predict when a pain episode is developing. This allows NeruoTune to respond before pain peaks. Third is targeted microstimulation. When NeruoTune detects abnormal signaling, it activates a grid of microelectrodes on its underside. Instead of blocking signals completely, the electrodes deliver precise low frequency electrical pulses that calm overactive neurons, encourage nerves to reset toward normal firing patterns, and reduce hypersensitivity. This stimulation is safe, gentle, and customized for each user's nervous system in real time. The final step is closed loop adaptive control. Unlike the standard stimulators that deliver one fixed pattern, NeruoTune's system is adaptive. The sensors contribute to monitor nerve activity during stimulation. The AI adjusts pulse intensity, frequency, and timing, and over days and weeks, the system learns what works best. This creates a personalized retraining program, like a physical therapist that learns exactly how your nervous system responds. NeruoTune eliminates the need for surgery, the chance of addiction, and the need for weekly doctor visits, while reducing the cost of relief and the chance of misdiagnosis. At the same time, it raises the chance of full recovery and user satisfaction while increasing personalization of care. Lastly, NeruoTune creates new AI enhanced solutions, neural recalibration, and patient autonomy. Our strategy canvas shows how NeruoTune creates a blue ocean strategy market by addressing major gaps in the chronic pain relief that current methods can't fulfill. Unlike current methods, NeruoTune offers a long term solution that is cheaper without needing to use drugs or undergo surgery. NeruoTune's current market is chronic pain patients already under specialist care, athletes and manual laborers who regularly use braces or topical patches, and patients at pain clinics open to wearable technology. Their first tier of non consumers are people in physical therapy who have plateaued, looking for an at home solution, and people using medications but wanting to stop due to brain fog or stomach issues. NeruoTune becomes the tool they've been searching for. Their second tier of non consumers are people who refuse opioids due to addiction concerns, people seeking a last resort non invasive alternative, and people needing a system that works passively while they work. NeuroTune offers a new drug free solution for them. The third tier of non consumers are people who are in early tech related pain but not ready for a clinic, and people who in underserved areas who have normalized their pain. NeuroTune opens their eyes to a new possibility, nerve training instead of lifelong management. The production cost of one patch is $60 and it is sold for $100 for a 40% profit margin, significantly cheaper than that of the competition. So let's not let people stay in pain and invest in NeuroTune.